Welcome to the parshealthhtv channel. We hope you're having a good day and you are happy and healthy. In this channel, we give you tips to keep you healthy and out of trouble. In this video, we want to talk about autism, causes, symptoms, and diagnosis. This video is for educational purposes only, and if you have any specific condition or illness, you should consult with your doctor. Autism is a congenital and genetic disease that is much more widely known and accepted today than ever before. Still, non-specialist celebrities, including actors, writers, and many famous people, have worked hard to raise awareness of these diseases and autism. Therefore, the treatment and support centers for children with autism, which we see today in many parts of different cities, result from many efforts. In this video, we also have decided to share some information to make people know more about autism. Stay tuned with us. If you like topics like this, make sure to subscribe to our channel and press the bell icon to see daily videos just like this one. Alright, let's get started. Autism is a neurodevelopmental disorder. Different parts of the brain in people with autism have difficulty working together. Autism is a developmental nerve disorder that occurs in the first 3 years of life and is lifelong. Autism affects how people perceive the world and how they interact with people. People with autism see, hear and feel the world differently. Autism is not truly a disease, and there is no definitive drug treatment. Still, with rehabilitation, a person with autism can gain skills and live an independent life and show a particular genius. Autism is a condition that can range from severe to mild. Being autistic manifests itself in different ways in a person's behaviors. Some people with autism have other accompanying problems, including mental retardation, sensory integration disorder, attention deficit hyperactivity disorder, and epilepsy. This means that these people need different levels of support. What causes autism? Autism has no single cause. It was once thought that psychological disorders resulting from traumatic experiences, head trauma, would lead to emotional and social deviation, which is not true. Today, researchers believe that several genes, combined with environmental factors, may be involved in causing autism. Some studies in people with autism have also shown abnormalities in several brain areas, including the cerebellum, amygdala, and hippocampus. These findings are significant and need further study. Prevalence of autism spectrum disorder. The prevalence of autism spectrum disorders has increased dramatically over the past 2 decades worldwide. It is generally believed that autism is on the rise. Research over the past 20 years has shown that the prevalence of autism is increasing for various reasons. In the early part of the last decade, the prevalence of this disorder was estimated to be 1 in 335 people. This rate has been increasing in recent years. According to the latest research, this statistic was reported in 2009 as 1 case per 91 people in the United States and 1 case per 66 people in the United Kingdom. Also, in the latest edition of the American Statistical and Diagnostic Guide to Mental Disorders, the prevalence is 1 to 59. Symptoms of autism. Social dysfunction. One of the significant symptoms of autism is poor social communication. Natural children are considerably social from the first weeks of life. In fact, the human infant is inherently ready for social communication and human face recognition, while children with autism have little inclination toward the human face. As a result, these children have a slight tendency to make eye contact. They have difficulty understanding the feelings of others. They are unable to empathize, and this is a major barrier to making friends. Communication disorder. Another major problem with autism is serious communication problems. People with autism have difficulty with various aspects of language, speech, and communication development. Children with autism cannot use language for social purposes. For example, they cannot use words and language to communicate socially. Half of the people with autism never use language and speech to communicate, and if they use words in their speech, the following problems occur. Parrot-like repetition of sentences and words that appear in 2 ways. They memorize the sentences and phrases used by others and then repeat them parrot-like without having those useful sentences. Misuse of pronouns. For example, instead of saying I, the child says he. When a person talks to them, they repeat their sentences like a parrot at the same time. Usually, there is no meaning in the speech of these children. These children use irrelevant words to communicate. They do not use conjunctions well in their speech. Cognitive impairment. There is also no abstract thinking in them. This means that the child cannot put himself in the place of others or think about things other than what he sees with his eyes. The lower the IQ in these people, the higher the risk of seizures. Motor abilities and tactile perception are also better in these people than the ability to understand symbolic concepts. Behavioral disorder. These children communicate better with objects and devices than with humans. In addition, they are unusually dependent on dysfunctional aspects of things and non-functional objects. There are also repetitive aimless movements such as shaking hands, walking on toes, and aligning or rotating objects. These children react very strongly to new situations and circumstances. They are terrified of new things, new people, changing their home decor, and even changing their family car and reacting to it. The play skills of these children are very low, and they cannot play social games. Problems with communication among children with autism are language comprehension, and children with autism is often delayed. Most of these children cannot even answer a very simple and clear question. They cannot understand jokes and do not understand implications, metaphors, and proverbs. These problems manifest in the early stages of development. The child looks less at others. The child grumbles less or not at all. When the child is called, he does not answer, does not react to his own name. The child smiles less in front of other people. The child does not communicate non-verbally. For example, he cannot point to his favorite objects. The child does not play social games or unilaterally and with themselves. Signs of autism usually appear by age 2 or 3. Some associated development delays can appear even earlier, and often, they can be diagnosed as early as 18 months. Research shows that early intervention leads to positive outcomes later in life for people with autism. If you are interested in videos like this, make sure to like this video and subscribe to our channel. We hope you have a wonderful day. See you in the next video.